You've probably heard it before. As men age, their penis shrinks, loses function, and there's nothing they can do about it. But what if I told you that much of what you've been told about penis health and aging is completely wrong? Some myths are so widespread that even doctors hear them from patients daily. Today, we're going to bust 6 of the most common myths, and the truth might surprise you. So if you're a man, love a man, or just curious about how the male body really works, stay tuned, because what you're about to hear could change the way you think about aging forever. As we go through life, our bodies change. That's a fact. But when it comes to the penis, pop culture, misinformation, and even awkward locker room talk have created a storm of myths. From size shrinking myths to testosterone rumors, we're diving deep into the science. We'll break down each misconception, explore what's actually true, and give you practical takeaways to maintain confidence and health no matter your age. Myth number 1. Penis size shrinks dramatically with age. Let's start with the most common fear, that the penis will shrink so much over time that it becomes unrecognizable. Here's the truth. Minor changes in size can happen with age, often due to reduced blood flow, decreased elasticity in tissues, or weight gain in the pubic area that makes it look smaller. But this is not dramatic shrinkage. In fact, the actual length loss is often less than half an inch over decades. Think of it like wrinkles on the skin, small changes, not total transformations. And much of this can be slowed or prevented with healthy lifestyle choices, maintaining a healthy weight, regular exercise, and avoiding smoking. Relatable example. Imagine 2 men at age 60. One is active, lean, and does cardio regularly. The other is sedentary, smokes, and carries extra weight around his belly. Guess which one reports better size and function? Yep, lifestyle matters. Myth number 2. Erections disappear after 50. Many believe that turning 50 is like a light switch. Erections just vanish. This is completely false. While erectile dysfunction, ED, risk increases with age, it is not inevitable. Most men in their 50s, 60s, and even 70s can still achieve erections, especially with good cardiovascular health. The penis is, after all, a vascular organ, and anything that's good for the heart is good for sexual function. Scientific fact. Studies show that healthy men in their 70s still report satisfying sex lives. The real enemies are untreated health conditions like diabetes, high blood pressure, and smoking, not the birthday candles on your cake. Myth number 3. Testosterone levels crash overnight. Testosterone, the male hormone, is often blamed for every change in libido or performance after middle age. Yes, testosterone does gradually decline, but it's a slow process, about 1% per year after the age of 30. That means a 50-year-old man still has much of his youthful hormone levels intact. The overnight crash idea is pure myth. What's more, lifestyle, diet, and sleep can play a huge role in how testosterone is used in the body. Suspense element. And here's where things get interesting. Low testosterone is not always the villain people think it is. Sometimes, symptoms blamed on testosterone are actually caused by stress, poor sleep, or even certain medications. We'll come back to why this misunderstanding can lead men down the wrong treatment path in just a moment. Flow into part 2 without a break. But before we reveal the truth behind this, let's bust the remaining myths, because one of them is so common, it's probably sitting in your own mind right now without you realizing it. Myth number 4. Frequent use wears it out. This one is as old as human history. The belief that sexual activity uses up a man's capacity. In reality, the penis is not like a machine that wears down with use. In fact, regular sexual activity, whether with a partner or through self-stimulation, can help maintain blood flow and tissue flexibility. It's similar to how exercise keeps muscle strong. Men who remain sexually active as they age often report better erectile function than those who become inactive. Engaging fact. Research even suggests that men who have sex at least once a week have a lower risk of ED compared to those who go months without activity. So rather than wearing it out, you might be keeping it in better shape. Myth number 5. Only old men get ED. Erectile dysfunction is often labeled as an old man's problem, but the truth is, younger men experience it too. In fact, studies show that about 1 in 4 new ED diagnoses are in men under 40. The difference? In younger men, ED is more often linked to stress, anxiety, or lifestyle factors rather than aging itself. This myth is dangerous because it can make younger men feel abnormal or ashamed, when in reality, the issue is much more common and treatable than they think. Relatable moment. Picture a 35-year-old man, otherwise healthy, suddenly struggling with performance. He might panic, thinking he's aging prematurely, when the real culprit could be chronic stress from work. Once addressed, function often returns to normal. Myth number 6, nothing can be done about changes. Perhaps the most damaging myth is the idea that aging changes in the penis are inevitable and unfixable. The truth? Many changes can be slowed, reversed, or managed. Medical treatments, lifestyle shifts, pelvic floor exercises, and open communication with healthcare providers can dramatically improve function and confidence. The worst thing a man can do is suffer in silence, believing there's no hope. Example: one study found that men who combined healthy eating, regular exercise, and medical treatment for underlying conditions saw significant improvement in erectile function, even in their 70s. Building curiosity to the end. So here's the reality. The male body does change with age, but not in the catastrophic way these myths suggest. By separating fact from fiction, you can make smarter choices, maintain sexual health, and age with confidence. And if these myths fooled you, imagine how many other people believe them too, which is exactly why this information needs to be shared. Strong call to action. If this video opened your eyes or busted a myth you believed, hit that like button right now. It helps more people discover the truth. Subscribe for more science-based, no-nonsense breakdowns about men's health, and drop a comment telling me which myth shocked you the most. Remember, knowledge is power, and when it comes to your health, the right information can change everything.